Ready?
Oh, sir.
Very good. Please wait. That's good. We are co-operating policy, sir. That's really good.
He Mahamate, He Mahamate.
As the organizing secretary, first I would like to welcome you all for this pre-conference workshop. I hope you will have a very good time in gaining new knowledge in your radio imaging career. So first, we should know what is NABH. National Accreditation.
Then we have anterior superior. We come to anterior superior and we see for the structures which are both the bony acoustic as well as the soft tissues. Anterior superior, we go to anterolateral. We go to anterolateral and we see for the structures again. And from anterolateral, we go to the posterior scan following with, I'm so sorry, we go to the posterior. So that's, of course, the transverse scan of
pathologies of the joint. So predominantly you want to look at all the structures which are there surrounding the hip joint, which can cause hip joint pain and hip pain. So these are the various muscles that are there in and around the hip joint, and anteriorly have all these psoas muscles and iliacus and iliopsoas inserting onto the lesser trochanter there, and laterally and superiorly you have the tensor fasciae and you have a sartorius muscle more anteriorly, and then all these adductors in the middle.
Yes, sir. Yeah, the most of the hemangioma that we talk about, especially in adults and all, they are low flow venous malformations, sir. And especially where it's very, very useful if it is an intramuscular venous malformation, where for the, especially for the surgeon, it's very difficult to operate. And the patient may have, deficit of after even operational. In those cases also, this is sodium tetradisyl sulfate. You may have to do some 2-3 times, 2-3 settings. May not be single setting, but it's quite rewarding.
And I'm very honored, I'm humbled to be here. And thanks for a nice introduction and chairpersons. Today, I was supposed to give very basic, totally off all the topics what we have here. Like body MRI, but I thought, we have a very good, smart gathering of radiologists here. So today morning I changed my topic to give a little bit advanced MRI, just to, not get you bored with basic concepts. So I'm still waiting for the laptop, sorry.
Faculty had just then come back from Vellore, and he was already an associate professor, and we had a wonderful time in the department. Fetal spine is what we are going to deal with, and the program says 1 hour. Do I still have 1 hour, or do you want me to cut, Dr. Anil? We are late, so shall I? Half an hour? Great. Okay. Done. So we'll aim for half an hour, and if I overshoot, don't curse me. You have to give me that luxury. Okay, now neurulation is a very important embryonic event which occurs, and when we say neurulation, it means formation of the neural tube. Okay, the neural plate is actually
30% of everyone in this room will not live till the age of 68, and most of us, if you do, you'll be demented. 90% of everything that is said in this room is repetitive. and nothing new is learned on a daily or a weekly basis after the age of 35. 60% of all males have ED. 90% of all of us live in the fear of tomorrow, 6% live in the fear of the past, and 4% lives in the present. 95% of us will die not achieving our dreams. Now, coming to the GP's perspective, 80% of consumers will see a GP in a year. More than half of the cases of diabetes and hypertension and hyperlipidemia are diagnosed by a GP.
MRI, and also we are doing for the barium enema takes 2.7 years of the background radiation. So what I want to say, if they want to do any barium enema, any studies, if they are discussing with us, if it is required, we will go ahead with that. If the patient is coming with some conditions where a lot of radiation is given, then again next week some other status or some other radiation related investigation is asked, radiation will increase, which is going to affect the patient somatically, means the present patient condition, and genetically. So I would like to say that if we have a wonderful discussion, we will be able to take the care of the patient. That is their aim and that is our aim. Doctor, you have to say?
Just 1 minute.
Yeah.
See for the specific nuclei. Nowadays, there is a huge big study which is being coming from Johns Hopkins and University of Michigan has taken it. If we can give bone age by doing ultrasound of the growing epiphysis, I think it's going to be marvelous for us if it comes out, because then our radiation dose is going to be so much more reduced. To entrap this little
workshop yesterday, and this has been dealt in the workshop yesterday about shoulder ultrasound. For those who have attended the workshop, it's going to be a kind of revision for them, and for those who have not attended, it's going to be a fresh presentation. So we all know these patients with the shoulder rotator cuff injuries present with painful arcs, night pains, and decreased range of movements. The other differentials for these could be due to the other reasons for patients presenting to you with shoulder.
Thank Dr. Shukla and the entire team of IRIA for inviting me today to deliver something which is fascinating. Very few people in India and abroad do what is known as advanced MR imaging of musculoskeletal tumors. So over the next 20 minutes, let me take you through a journey of the advanced imaging techniques which are used to visualize, characterize the musculoskeletal tumors. The first and foremost, you should remember that radiography remains the first line.
A very good morning, ladies and gentlemen. At the very outset, I must thank the organizers for giving me this opportunity. I bring greetings from the largest hospital of the Indian Air Force, the Command Hospital Air Force, which is in Bangalore. I'm going to talk today about a joint which is possibly the most mobile joint in our body and also the most inherently unstable joint in our body. So it's very prone for instability and injuries. And this certain group of people are more prone, more predisposed to this instability and the injuries. And ladies and gentlemen, it is these very subgroup of people who cannot afford to have, who want to come back.
Treated as such without any side effects at all. So he quickly realized the potential of these in utilizing the imaging of gastrointestinal tract. Here you can see two pictures, one of the stomach and the other one of intestines, ulcer and malignancy. So what started as a simple contrast study in the GI tract has today grown into a very vast field of dynamic imaging with the advent of fluoroscopy. That is image intensifier. I'm sure XRAKD will agree with me. See, in the olden days we used to do fluoroscopy, screening, we used to call that, dark room fluoroscopy, which is very, that was because we had acute shortage of X-ray films, especially in government institutions. So fluoroscopy is the...
And this is only 20 minutes is allotted. It's just a pictorial tour for you rather than a theory session. It's just a pictorial tour for you. And after the session, you will come to know how easy a neonatal spine is. MR is difficult to interpret, but neonatal spine ultrasound is really easy to interpret. So the hidden phrase in this is an example. So that's the first aid. That is the hidden phrase. So next one. Very nice. Stop sequence. Excellent.
Well supplied compared to the proximal pole, and any fracture through the waist results in a compromise in the blood supply to proximal pole. There are few anatomical variations that are important. Most important is bipartite scaphoid, which should not be mistaken for a scaphoid fracture. Here we can see a bipartite scaphoid with well-defined cortex all around, and obviously if there is no history of a fall or anything, we don't give a scaphoid fracture as a diagnosis. Other variants are correlation with neighboring bones and scaphoid hypoplasia. There are various classification systems that are followed. Most important is the Mayo classification, where the fracture
is the extrathyroidal mass. Similarly here, cystic lesion seen anterior to the left lobe of the thyroid, and we could see there is a definite differentiation from the left lobe of thyroid, and it was a cystic lesion which was extrathyroidal in nature. Now the midline swelling, in the midline swelling, the most important is start from the submental region and going down to the suprasternal notch. At every side we have got some regions there. In submental region, the submental lymph nodes are the most common. Then we have got the dermoid
system. We focus mainly on these 4 technologies. Basically we got a scheme that is without changing the patient or without changing the coil, we can do the whole body scan. For example, the patient is referred for a long bone imaging. Without changing the coil, we can do the scan sitting in the console. This is called a scheme. Then in MR, the most complex parameters, basically we have 63 different imaging parameters like TR, TE, bandwidth, lot of parameters. This will be completely taken care of the system by using a platform kind of dot platform. Irrespective of anybody, for example, you have an experienced radiographer and a new one, both of them can do the same job. The parameter adaptation, FOV adaptation, everything is done by system automatically. Then we have life design. This is basically we have patient-friendly design for systems. So my topic, I am going to cover these 3 topics. How we make the
from first MD or first year PG to third year exam going PG. I request whoever are students better to be in the center. I am not going to ask you any question. More you interact with me, it is my selfishness. I will be learning more from you. I sincerely thank Dr. Balkrishna for being the chairperson for this. And let me go ahead with my little talk. I have put it medical imaging. I know it should not be put, but nowadays it is better to put. Many people will be utilizing so many filming, so it is purely